Greetings and welcome back to the Journal of Oncology Practice podcast from ASCO. This is Dr. Bob Miller of the JOP editorial board and medical oncologist at Johns Hopkins. Well, here's a pretty non-controversial statement. Running a successful medical oncology practice in 2012 is complicated. And of course, I'm not just referring to the complexities of practicing medicine in the modern genomic era or the emotional challenges of dealing with chronically ill patients in difficult circumstances. Gone are the days where a practice could count on a single stable business model. To be successful in the modern era, oncologists must develop a deep working knowledge of the myriad business and transactional forces that shape today's practice environment. Providing oncology professionals with information and tools to promote quality care and improve administrative management has long been a central mission of the Journal of Oncology Practice. To that end, the March 2012 issue of JOP has a special series devoted to coverage of a multi-stakeholder conference held in Chicago in October 2011 that you may not be familiar with. I'm referring to the annual Cancer Center Business Summit, and for this podcast, I'm pleased to be able to speak with two of the principals of the conference. Let me introduce Dr. John Cox, who is, well, my boss. Well, not exactly, but John is the editor-in-chief of the Journal of Oncology Practice and a practicing medical oncologist in Dallas. He was a member of the planning committee for the Cancer Center Business Summit. John, it's great to have you this morning.
Glad to be here, Bob.
Also joining me is Ronald Barkley. Ron is a healthcare business development advisor who's passionate about converting fragmented healthcare services into integrated and accountable systems of care. His particular areas of expertise include the alignment and integration of community oncology practices with hospital-affiliated comprehensive cancer center service lines, the positioning of oncology within accountable care initiatives such as ACOs and medical home constructs, and physician compensation models associated with the above and designed to fairly compensate oncologists. And thanks for joining me as well, Ron.
Thank you for having me.
So let me start with you, Ron. Tell us about the origin and structure of the 2011 Cancer Center Business Summit, and who was the intended audience?
Sure. The 2011 Business Summit was actually our fifth consecutive year in thought leadership and featuring the developments and trends in our consolidating oncology sector. We have particular emphasis on the predominant strategic options, business, financial, legal, and oncology hospital alignment models, and regulatory challenges, facing oncologists in today's rapidly evolving healthcare environment. The summit program content and faculty appointments are vetted through our national advisory board, member of which is Dr. Cox, and we are supported financially by some 35 sponsoring organizations. The theme of our 2011 conference was Achieving Accountable Cancer Care. Regarding the attended audience, there are approximately 400 attendees at our conference, consisting of oncology medical group practice leadership, about a third of the audience, hospital and health system executives and oncology service line directors, another third of the audience, with a balance of the remaining third made up of health insurers, professionals such as legal, accounting, and consulting advisors, and industry representatives. Our website is www.cancerbusinesssummit.com.
And Bob, if I can add on, I am a member of the advisory board, but when you talk about the principals that organize the conference for the last several years, are really three groups. Foley and Lardner, which is a large law firm, their health care section has been a real stalwart in supporting this meeting. Alto Solutions through their division of oncology metrics, and then the firm that Ron leads, the Cancer Center Business Development Group. It's really those three folks that have created this summit. In the last 2 years, ASCO has participated in the advisory board, the planning committee, if you will, to help organize the summit. And so our professional organization realizes the sort of gap that we have in addressing these issues that the Business Summit deals with. I'd also sort of add on to what Ron said. What strikes me when I go to this meeting is the markedly different kind of audience that I have attended a meeting with from any other meeting. And that is it includes both large and small oncology practices, representatives of institutional and academic practices, even large NCCN member institutions send representatives to these meetings. And then it has this wealth of folks that Ron alludes to, the healthcare transactional consultants, legal consultants, business consultants. It really makes for an interesting mix, both on the dais of the speakers that are presenting topics to the audience, but also just sitting in the audience who you connect with.
Tell me about some of the sessions during the conference. What were some of the more interesting sessions, and what were some of the take-home messages?
Basically, all of the sessions received pretty high audience ratings, but I'd say that some of the more noteworthy topics would include the results of our annual industry survey, which for 2011 was on the subject of positioning and payment for oncology within accountable care initiatives. I think that the primary takeaway from our 2011 research was that despite the magnitude of the cancer spend, oncology was not really on the radar screens of ACO planners at that time, with their focus being instead on building the basic ACO analytical infrastructures and formalizing primary care relationships. Keep in mind that our 2011 survey was conducted basically a year ago, prior to the issuance of the final regs. Certainly much has transpired in the ACO environment since that time, and we are pursuing a similar research theme for 2012. Another session that's noteworthy would be our Trends and Predictions presentation, which was based on the National Practice Benchmark Survey, taking their results from 25 to 2010. Certainly the trend lines presented in the practice revenue decline against practice cost escalation over that 5-year period begged the question, how will private practice survive financially moving forward?
Now, was this the national practice benchmark survey from Altos?
Correct. Oncology Metrics, Altos produces this survey annually, and is a standard feature of the summit to present their findings. Going to our keynote presentation by Dr. Peter Bach from Sloan Kettering, who spoke to Will ACOs Bundle Off Oncology, was a highlight. And a takeaway for me was the image of oncology drug costs run rampant. Our payer-provider collaborations panel, which is a standing panel of the summit, this year showcased a number of examples of experimentation in oncology payment redesign methodologies, with an overriding theme being that the migration from volume-based legacy payment methodologies is monumentally complex to implement, and that we're all at the early stage of this experiment together. I think that the plenary session on ACOs, how will oncology fit in, a didactic session on that subject, was content-rich, with the general conclusion coming out of that there is no clear fit for oncology in the Medicare ACO context, but certainly that oncology's fit within activities of commercial health insurance is alive and well and in proactive experimentation. Another session that was well received was our medical home session entitled Medical Homes, Owners or Neighbors. That was moderated by Dr. Cox. I would characterize it as a real blockbuster. The takeaway from the oncology medical home presentation was that without support from the insurance sector in the way of meaningful payment methodology redesign, that the care management and cost-saving features derived from this oncology medical home model just isn't going to get off the ground. The existing volume-based buy and bill methodologies just don't work in transforming practice patterns to the medical home model of care. Then I'd say finally that new to the summit for 2011 was the Call for Abstracts program, with the display of the winning abstracts at the summit itself in a poster session, subsequent publication in JOP, the March issue. And that was certainly an enriching experience for the attendees, and we hope as well for the JOP readership. And we look forward to this continuing abstract program that's actually managed by JOP as a standard summit feature.
So that's a good transition. Let me ask John a little bit about that. I see you published 9 of the accepted abstracts, and there were 2 longer manuscripts that were in this JOP issue. What was JOP's goal in presenting this kind of work to its readership?
Well, it is really a double-pronged answer to that. First was, as you've heard from Ron, the meeting itself, the Cancer Business Summit, has been a very transactional focused meeting. One of the ideas with ASCO becoming involved in the planning process was to see what we could do to help inform many of those business thought leaders of sort of the mind of an oncologist. And we are basically scientifically oriented. We are used to very open communication about best practices, and we're used to the idea of presenting our work in a very public forum for critique. So the idea was to bring that scientific background to this business meeting. So we created a call for abstracts, asked for abstracts hopefully rich in data, but even just formatting business practices and principles that could inform the summit. And then the goal of having the journal involved was, this is the kind of abstracts and the kind of papers that we would really like to bring to the JOP. The journal's mission is that joining of our delivery of care, which is key to access of care, to the quality and efficiency of care. And when we talk about value in oncology, it's going to have to take in all those spheres. So asking for business folk to sort of adapt their thought to our sort of scientific principles for sharing information was the idea behind this. I'm hopeful that this will be successful. We'd like to see the number of abstracts grow, and the types of abstracts grow. If I could refer the reader or their listener to the March JOP, the 9 abstracts are all interesting. They're pretty diverse. All of them are, I think, of interest to our community.
I think that's a great addition to the JOP for this issue. Let me ask a little bit about the whole idea of accountable care in oncology. You mentioned that oncology is not really thought to be an attractive candidate for cost savings using this model. Why is that?
Well, if I may, I'll take a crack at that complicated question. I think in the ACO context, it's useful to distinguish, the formal CMS-designated ACO, the Medicare ACO, which is the vehicle through which the Accountable Care Act actually implements the Medicare Shared Savings Program. Distinguish that from the non-Medicare ACO-like activities that are more within the commercial health insurance sector. They're, to a certain extent, different animals. We're at the early stage of getting oncology, essentially the cancer spend, interpreted in a manner that can be digested by the Medicare ACO innovators. Oncology seems to be too complex for the ACO planners to grapple with on their own, and I think this presents an opportunity for us to help them understand the significant cost reduction potential that we can derive from focused care management with our cancer patients, and how they can work that savings opportunity into their MSSP formula. I do think that in 2012, this year, we will be seeing much progress in this regard. And in the meantime, I think oncologists should certainly stay attuned to any ACO developments in their own local communities, and perhaps even invite their major commercial payer or payors to the table to even explore opportunities for experimentation in payment redesign for the practice. Certainly United Healthcare, Aetna, and a handful of Blues plans have some pioneering efforts in this regard.
Mm-hmm.
I don't know that I have a lot to add to Ron's answer other than to emphasize his note that all ACOs aren't equal. And I think particularly keeping an ear toward commercial payers in your market. And I like his idea of looking for opportunities of experimentation. I think that's key, because I think the stem of your question, Bob, is true that ACOs don't know what to do with oncology right now, and they are looking at different models on how to incorporate what is an expensive proposition for any payer.
So what are some of the important trends in accountable care that oncologists should be tracking in 2012?
I think there are at least 3 oncology-specific CMMI Innovation Challenge grant applications that I'm familiar with that were submitted in January. Think of the Innovation Challenge as being up to $30 million per grant to demonstrate how to reduce the cancer spend and to restructure oncology payment. The March deadline for announcing the grant recipients, which was in late March, has come and gone. And so we're all anxiously awaiting the announcement of the grant recipients, hopefully with some of the oncology-specific requests to CMMI being in the running. Unfortunately, I've heard some unsubstantiated rumor as of late that any applications that are proposing oncology or cancer innovation to CMMI are being shelved for the moment in favor of CMMI's alleged plans to announce a program in oncology bundled pricing innovation sometime in 2013. So, we're anxiously awaiting to see if that happens. Mm-hmm. But it looks like it's a year out. So I would say, as a heads up to community oncology, is to potentially identify your institutional hospital dance partner now in anticipation of an oncology bundled payment initiative to be announced next year. Kind of think of it as a potential virtual alignment strategy with your hospital.
And I'd pick up a little bit, maybe looking at a global thing is we've just had last month the arguments before the Supreme Court about the Medicare or the healthcare reform. And I guess I'd really emphasize to listeners and to readers is that whatever happens with the politics, whatever happens with the Supreme Court's decision in weighing in on the Healthcare Reform Act, that the move to value-based purchasing is not going away. ACOs are not going away. And certainly there could be parts of the act, if struck down, that might change CMS's approach to some of these issues, but the overall overarching goals are not going away. And I think, as Ron noted, there in the future, you can't be an island anymore. You're going to have some form of integration strategy in the community of the practices in which you practice. I do think there are opportunities if practices will look at their primary institutions they're practicing in. There's likely clinical integration projects underway, and it's really important for oncologists not to remain on the sideline. They need to participate in those meetings and to be a leader in their community in those discussions. And I think that's nearly a cultural disconnect from the way oncology has been practiced.
No, I would agree, John. I mean, I think that this is the era of engagement, and it's not in the DNA of a lot of us, unfortunately. I think that has to change. Let me ask you about future plans for the Business Summit. Is this conference going to be held in 2012?
Yeah, we are scheduled for October 11th and 12th. We're holding our venue at the Renaissance Worthington Hotel in Fort Worth this year. We'd like to point out again that ASCO has agreed to even take a larger role in the summit moving forward, and intends to become a co-host organization of the summit effective this year. And we're certainly looking forward to the relationship with ASCO that's designed to take the summit program to the next level.
So I guess bottom line, how optimistic are you really about the viability of oncology practice in the coming years? What are the things that oncologists really need to change to ensure their success in these changing times?
From my viewpoint as a business development advisor, community oncologists moving forward should basically think of leaving no rocks unturned in their local settings. Stay attuned to who's launching what accountable care initiatives in your local community. Probably have an open and honest dialogue with your practice colleagues regarding your future vision of the practice. Where do you want to be as an organization, and certainly as individual professionals a year from now, maybe 3 years from now, 5 years from now. I think after that horizon, the crystal ball batteries run out beyond 5 years. Can you ask yourself if you can survive at status quo? Would partnering with others provide you some security? Who could you envision partnering with? Maybe is it another oncologist in an expanded group practice construct, or maybe clinically integrated network? And certainly is alignment with a hospital or a health system in the cards, and something along the lines that's more robust than just simply an employment model.
I'm very optimistic about oncology. I guess the first thing that drives an oncologist optimism is the revolution that's occurring in the care of our patients. With that, you can't help but to be excited about our science. And I would foster to oncologists that there is an equal revolution occurring in care delivery. And rather than fighting it, we should embrace the fact that as care becomes more integrated, that practice can actually be more fun. And that maybe some of the barriers that have been constructed because of the buy and bill practice model, you take away some of the perverse incentives that are present in our practice, can actually improve care and potentially improve enjoyment. But to get there, I think we're going to have some rough roads, because change is difficult. And ultimately, like we were talking a minute ago, this is going to require change in the culture of our practice. I'm very optimistic, though, that 5 years, 10 years from now, we'll look back and wonder why we didn't do some of these practice transformations, more integration of our practices with the folks who send us patients and refer us patients, and the institutions we practice with. I think there's a wealth of improvement that we're going to see in those areas.
Dr. Cox and Mr. Barkley, thanks very much for taking the time to talk with me this morning.
Really appreciate it, Bob. Interesting process and interesting times.
Yeah, it was my pleasure, and hopefully the information is going to be useful to those that listen.
And please take a look at the March JOP issue for additional abstracts from the Cancer Center Business Summit and other great articles. And don't forget to send your gentle comments about these JOP podcasts to jopeditorsdesk@asco.org. You can also tell us what you think on our iTunes page. This is Dr. Bob Miller for the American Society of Clinical Oncology. Thanks very much for your attention.